Unintentional or accidental injuries are often avoidable, yet the facts are grave indeed. Serious unintentional injuries are one of the leading causes of death and disability in young children. The risk of unintentional injuries increases with age. Boys are more likely to be injured than girls. These injuries can occur in the home, at school, on the road, and during play and recreation. The highest risk area for children under 5 is in fact not the outside world, but the home. And children in deprived areas are more likely to be injured than children living in higher socio-economic locations, due to their increased exposure to risks that can be associated with housing design and maintenance. Once again, negative social situations have a negative impact on health. Compared to older children, children under 5 are more likely to experience injuries in the home, such as falls, burns, and scalds. Interventions that may reduce these unintentional injuries are therefore important, especially where deprived families may lack both the information to enable them to identify and manage risks in the home and the means by which to purchase and install home safety equipment. These interventions are not designed, as they say, to wrap children in cotton wool. Children benefit hugely from indoor and outdoor play and leisure activities, which of course do carry an element of risk. Rather, these interventions are set in place to reduce avoidable risks and dangers in the home. Effective interventions come in two forms: the provision of home safety equipment and education. In terms of safety equipment, items such as smoke alarms and stair gates could be provided and fitted for free or at a substantial discount. This could be arranged through collaboration between service providers in low-income communities. In terms of education, the key factor is encouraging mothers or primary carers to be the safeguarders of their children, to, for example, look out for potential dangers in the kitchen, such as sharp utensils, boiling water, and hot pans. Injury prevention advice, such as keeping medicine out of reach, using child-resistant containers, and watching out for choke hazards in toys and ornaments, can be helpful for families. All this can be linked to information about how children's behaviour, including their inquisitiveness and mobility, changes as they get older. This education can be delivered in the most appropriate manner, perhaps during a home visit or at a preschool session. There are, however, a number of barriers to the effective delivery of such interventions. The safety equipment may not be available for free or at a low cost, and will therefore be financially out of reach for the family. The equipment may be poor quality or badly installed. The family may be living in rented accommodation that they are forbidden from modifying. And in some families, the mother lacks the autonomy to make major household changes or decisions about household purchases. This may also limit her safeguarding role. It's therefore important not just to target information provision and advice solely at mothers. For these reasons, home safety legislation or strong policy drivers can result in effective injury prevention. Reducing avoidable, unintentional injuries in vulnerable families is part of the broader aim of family care, delivered in parallel with other interventions designed to mitigate the effects of deprivation.